Hello and welcome to DD Nagaland. We are going to talk about vector-borne disease. The National Vector-Borne Disease Control Program is a program in Nagaland that aims to prevent and control vector-borne diseases. The diseases covered by vector-borne control program includes malaria, Japanese encephalitis, dengue, gala azar, chikungunya, and filariasis. In Nagaland, the vector-borne disease control program has some success in reducing the prevalence of malaria, which was once endemic in all the districts of Nagaland. But the number of cases has decreased since 2018. We have with us in the studio experts from Department of Health and Family Welfare, Dr. Tinurendra Anichari, Deputy Director, and IMSA Bentla, Public Health and Training Consultant, Vector-Borne Disease Control Program. Doctors, thank you and welcome to the studio.
Thank you.
Well, Dr. Tinu, to begin with, what are the significant programs and activities under National Vector-Borne Control Program?
Under the National Vector-Borne Disease Control Program in our department, we have started to enhance the surveillance to track and report malaria, Japanese encephalitis, dengue cases promptly. So an official notification from the government has been given to all the public and private hospitals to notify as and when any cases are detected in the hospital. So we have prompt reporting from all the hospitals. Now even the private hospitals, they are reporting promptly on any of the cases of the vector-borne diseases that is detected in their hospital.
I see.
And also we have entomological zones where the entomologists, they really go to the community and continuously monitor the presence of vector and the vector density so that they can do the study, conduct a study and find out where there's possibility where all these vector-borne diseases might come out, outbreak might just come out.
I see.
And so, and we have the next one is after the enhanced surveillance, we have awareness program for the public to educate on prevention about the symptoms and early health-seeking behavior of the community. So in Nagaland, the health-seeking behavior is a little bit on the low side. So we really want the public to, to come for health checkup as early as possible, as and when they have any symptoms. And then we are using the church platforms also during the church before the church services. We request the pastor or any of our staff from that particular district or particular block to go and give a small talk regarding this prevention, also about the symptoms, and then to seek help as soon as possible. So that is what we do in the church platform, and we are very grateful to the churches also for helping us and letting us use the church platform to give awareness regarding these vector-borne diseases.
I see.
And also we also have lots of press advertisements, like even in the Facebook or Twitter, WhatsApp, YouTube, Instagram, and miking in all the blogs by our staff regarding this awareness and prevention. This is all given by our staff. And IEC materials like posters, leaflets, hoardings are used for awareness campaigns. And another one is we have this vector control also, where number one is a source reduction. For detection and elimination of mosquito breeding sites, staffs, they visit the houses to assist in removing the stagnant water and also to give education to the public, to the households, to ensure that there is no stagnant water in their surroundings. And then especially for dengue, as like last year we had an outbreak of dengue, and this year also we are a bit afraid that dengue outbreak might occur. So especially in discarded tires, the flower pots, containers, even the bottle caps and all, wherever there's any small amount of water that can be accumulated, those are the places where this Aedes mosquito, they breed. So all this awareness have been given to the households.
So you have a wide variety of activities and programs going on. Dear viewers, it is very important for us to understand when we are talking about vector-borne disease, we have a lot of people, the whole team of medical department is doing awareness and programs come into the churches, come into your localities, to the communities, and giving you information about vector-borne disease, which you and I, we commonly understand it as malaria, and these days we talk about dengue. But if we are not able to take care of our surroundings and environments where we allow water to get accumulated, and this stagnated water can be, a good breeding ground for the vector-borne mosquitoes to breed and cause disease to us. So whenever the medical team comes to your place or my place, we should be able to cooperate with them, listen to them, and this is for our own good as well. Moving further on, the Imsabentla, what are the vector-borne diseases that is common here in Nagaland, and is it spread across the whole state, or is it specific to some districts?
Okay, so far the vector-borne diseases which are prevalent in our state are malaria, Japanese encephalitis, dengue and chikungunya. Like you have said earlier that malaria intimicity has been decreased since 2018. And regarding to dengue, like last year, so it was reported from all over the district.
I see. Dengue reported from
all over the district.
All over the whole of Nagaland.
Whole of Nagaland. Yeah.
Oh, that's something we have to. And Dr. Tinu has also mentioned they are making all efforts so that dengue outbreak does not come, and it is very important for the public to really cooperate with the medical department and see that this outbreak does not come. Well, Dr. Imsa, what are the testing facilities for dengue and Japanese encephalitis?
Yes, so far regarding this testing facility available in regarding Japanese encephalitis is in Dimapur District Hospital. For Japanese encephalitis, and for dengue it's available in Dimapur, Kohima, Toensang and Mont, and the remaining district it's on the process, it's ongoing. Yeah,
I see. And about dengue?
Dengue, that testing facility is available in Dimapur, Kohima, Toensang and Mont district.
Dimapur, Kohima, Toensang and Mont district.
Yes.
Well, you have testing facilities of malaria
in all over the
over the states.
Yeah, in all over the state. Yeah, it's tested free of course. You will find it in district hospital, PHC, CHC, then the sub-center and Health Wellness Center. Yeah.
I think that's an important thing for all of us to note that the malaria test is free. You and I like free. But unless Dr. Tinu has mentioned, unless we develop that good health-seeking behavior, we will be having kalipal hoi jabo, it's okay, I'll get well, and it may be too late. So let us go to the hospital, to the primary health centers, to the CHCs and get tested if you have any doubt or if you're exposed to mosquitoes.
Yes.
Well, Dr. Tinu, what are LLIN bed nets and larvivorous fish?
LLIN bed nets are the long-lasting insecticidal nets which have been treated by the insecticides. And so this is the key to vector control intervention for population at risk of malaria and all the other vector-borne diseases. So when a person, this LLIN bed nets, these are distributed free of cost to all the people. And so this year also we have distributed from the GOI, from the government of India. They have dispatched the LLINs to Nagaland during December and January. And then from March onwards we have started distributing to all the districts. So far we have we know that it has been distributed to till the last village of Nagaland.
I see.
And regarding this, I really want to request the public also, whoever have received these LLI nets, we request them to use these nets properly. Actually, the expiry, it will last for at least 5 years. So
5 years.
5 years, at least for 5 years. So we request the public to ensure that they use the LLIN properly, and especially for those living in the outposts, and especially Jum cultivation and those who are always going to the forest, we request them to use this L-lion so that the mosquitoes will not bite. It's not that all the mosquitoes will bite, but the infected mosquitoes will be biting. But we don't know which one is the infected one, which one is not the infected one. So just that you have to ensure that you prevent oneself from getting bitten by the mosquito. So that's what in larvivorous fish also, those are the fish that eat mosquito larvae, used for, like we say, for biological control of vectors. So we usually in Nagaland we use the guppy fish. So these are for biological control. We give this to be put in the ponds, rivers, and wherever there's water collection in the paddy fields. So that's what we do.
I see.
Yeah.
Well, I want to ask Imse, what are the myths and misconceptions about malaria?
Myths and conception not only regard to malaria, but like it implies to all the vector-borne diseases. Like whenever our state in VBTCP team, we go for like monitoring and supervision to almost all the district we used to visit. So as per the feedback, and we interact in the community with the villagers. So what we find is that most of our people are aware what are the causes, how it's transmitted, this malaria, JE, dengue, and chikungunya. But there are some certain people in the villages also still they have to be like aware to reach them out. We interacted with them. They said that some myths and conception, like it is transmitted through drinking polluted water, so like drinking unclean water. So just want to make them aware that it is spread through like biting of infected female mosquito, Anopheles mosquito, like malaria. For malaria it is transmitted by the biting of female Anopheles mosquito. Dengue and chikungunya, it's spread through the biting of Aedes mosquito. Then Japanese encephalitis by the bite of Culex mosquito. It's transmitted through the biting of infected mosquito, not because of drinking polluted water or unclean water.
I see. Well, if you're drinking polluted water, definitely you'll get some other diseases, but definitely vector-borne disease, polluted water is not the cause, but it is the mosquito that is the cause. And you and I wish that we know which is that Anopheles mosquito, but it's difficult to differentiate the mosquito in a layman's eye. But as Dr. Tinu has mentioned, the government is supplying all of us to the last village the mosquito nets, the treated mosquito nets. So let us use that. Is effective for 5 years, and so let us use the mosquito net that is given. I know my mother and my father in Dimapur, they also get that mosquito net, and when we go down to Dimapur we use that as well. So but besides being home, we should also be able to pass this message to the people who go to the field, maybe those people who go to the jungle for whatever things that they do. But if it is a mosquito prone area, then we should be having protection, and the L-line mosquito net is, or the treated mosquito net is one best solution that will protect us. Well, continuing with you, Imse, where can we get this larvivorous fish? Is that edible?
No, it's not edible. It's only larvae mosquito. So these larvivorous fish we get Dimapur. That is, we call it UVBDS. That is under CMO office Dimapur.
Dimapur.
This one hatchery, and another hatchery. It's located in Tuli, CHC. So it's under Mokokchung district. So public can come and avail. It's like free of cost. Then also it is also distributed in coordination with the village council and with the urban authority also.
I see. So we can get larvivorous fish from CMO Dimapur and contact Tuli medical department. Then we can avail those fishes.
Yes.
Okay. Well, moving to Dr. Tinu. What is anti-malaria and anti-dengue month? Why is it observed?
Okay. Anti-malaria month is observed in the month of June. This anti-malaria month is observed all over the country, the whole of India. So why it's in June is because it's prior to the onset of monsoon season and before the onset of transmission. We want to give enhanced awareness, the level of awareness to increase, so as when monsoon season comes, that the mosquito breeding is more, humidity is more. So when it's really humid, the breeding of mosquito increases a lot. And so we have more chances of getting bitten by the infected mosquito. So before the onset of monsoon, so they want to give the message that you have to be aware that you might get infected with malaria. So with all this prevention that you are supposed to take care. So they also want to encourage community participation in order to ensure that this prevention of getting infected by malaria should be conducted. And then the anti-dengue month is also observed in July. This is also observed all over the country. So it's like the peak season for dengue is during the monsoon season, depending on the environmental factors, especially now with the climate change. With so many talks regarding climate change is going on. So during this time, there's lots of rainfall, very hot temperature, humidity is high, and then when it's very humid, virus, it replicates faster.
I see.
Yeah, and it's more ideal for proliferation of the mosquito larvae into adults.
I see.
And so this will cause more increase in dengue cases, plus even JE, also malaria also, and all the vector-borne diseases. So it enhances the breeding of mosquitoes. So Government of India also, they've decided, they've set this date as anti-malaria, anti-malaria and anti-dengue months, so that we'll give awareness to the public in advance before the onset of monsoon and during the monsoon. So that's what we do. And for community awareness, especially to keep their houses and surrounding clean, that is one of the most important thing. This year for the anti-dengue month, the theme for the anti-dengue month was connect with community, control dengue. So because only medical department cannot control dengue, so we need the participation from the community and all walks of society. So everyone should participate in ensure that this prevention, keeping the surrounding and houses clean, it's a must for all of us. So that's what even the GOI also, the Government of India, they wanted the community to participate to ensure that the awareness is created and that we keep our surroundings clean.
I think the theme itself is very important here. Connect with community. Control dengue. And when we are saying connect with community, the department team will be going out to the community, to the villages to do their work. It is the community, people like us, who have to extend cooperation, learn from the experts, and be able to stay healthy and fit away from these vector-borne diseases. Earlier, Dr. Tino was using the very technical term for me, entomological zone. So, Imsa, would you like to explain what is entomological zone and how is it set up?
Okay. Entomological zone is the division of district, division of district for entomological survey and to conduct entomological activity. So, in our state, we have divided into 3 zones. One is Kohima zone, Mokokchung zone, and Dimapur zone. So under Kohima zone, it looks after Kohima Phek and Kipri district. 3 zones. Then under Dimapur zone, Dimapur district, parent district, Mon and Wokha district. So that Dimapur zone to take up that 4 district. And when it comes to again another zone, that is Mokokchung zone. So under Mokokchung zone, they look after Mokokchung, Toinsang, Zenupoto and Longling district. So that is the setup and how the entomological zone is set up in our state.
So it's basically administrative convenience.
Yes.
Administrative convenience. But for us, what is important to know is that mosquitoes spreads these diseases and we must stay away from it. That's the important message we have to give. I have one last question and any one of you can answer. What are the prevention and control measures for malaria, JE and dengue? Who would like to?
We can like supplement
As we
together.
have already said, keep your surrounding clean and clear stagnant water. So it's like the clogged drains, the discarded pots, containers, and especially tires, the flower pots and planters, uncovered water drums, wells. All those things are the sites for breeding of mosquitoes. So we really have to keep our surrounding clean and clear the stagnant water that is present in our surrounding house. Also, like I'm not endorsing any company, but it's best that we use mosquito repellent, whatever is available in the market, mosquito repellents, and then we have to use liquids, coils, mats, whatever is available and whatever we can afford to use, if we can use it, and especially like wearing of full sleeve shirts and full pants with socks, which is very difficult in the summer season. So best is
Dimapur, yeah.
Dimapur. Yeah, best is to use repellents.
I see.
And then use of bed nets, as we have already discussed. So, and then use of larvivorous fish wherever feasible. And then proper covering of stored water. That is because during the monsoon season, we all collect water, especially in most of the hilly regions. We don't get water properly, so we collect the rainwater. So when we are harvesting rainwater, it's best that you keep all the pots and pans, whether it's small or big drums, just keep it covered so that the mosquito will not lay the eggs there.
I see.
So that is what we request. Also, especially regarding outbreak of dengue, from last year we have started this. We are requesting the public and the community to observe the weekly dry day, so that once a week, like even all the society, in the, like they should clean their houses and ensure that all the pots and pans which are discarded outside, they are discarded of the water that is contained there, and then so that all the containers which is unnecessary, it should all be, the water should be discarded so that mosquitoes will not lay eggs. Plus whatever containers you have collected water, keep it covered and keep your surrounding clean. So that's observation of weekly dry day. Some districts where there's not much rainfall, maybe twice in 1 month, fortnightly, you can do dry day, observe dry day.
I see.
So even covering of doors, windows, ventilations with wire mesh wherever we can afford, that is very good. And then impart knowledge to common people regarding the disease and vector through the various media sources, and especially sensitizing the involvement of community for prevention and control of vector-borne diseases.
That's it, like encouraging like community for cleanliness drive, sanitation drive. Yeah, that is also very important.
I'll get back to you for one message, but before that, let me talk to my audience once. Viewers, it is very important for us to realize by now that we can stay away from vector-borne diseases. We can stay away from diseases caused by mosquitoes. We have diseases like malaria and dengue, which is more commonly, the dangerous vector-borne diseases that is facing us. And the Department of Health and Family Welfare under Government of India Health Ministry have been supporting with lots of programs, awareness, IECs, and the idea of a weekly dry day. We have to understand that concept as well. Weekly dry day matlab not the one dry that you would normally come to think of, but the dry day is that day where you check your surroundings, keep your environment clean, and see that there is no water accumulation in the pots and pans that's been thrown around, or particularly old tires. Those are perfect breeding place for mosquitoes, and so we have to throw away the water and keep them dry. And as Doctor mentioned, you can do that in dry places. You can do that once a month or twice a month, but in wet places we'll have to, or where you have lots of water, you have to do it weekly. And if that develops into a habit of your cleanliness habit, then I'm sure you and I can stay away from vector-borne diseases as well. And another point that I wanted to make is larvivorous fish. Well, I thought that was to eat, but it seems that's not to eat. but that's found, that can be, taken from CMO Dimapur and
Tuli CHC.
Tuli CHC. So those people around those places, you can get these larvivorous fish and put it in places where there are breeding grounds for mosquitoes as well. So these are the things that we'll have to keep in mind. And very importantly, government is providing us free testing facilities and free treatment.
Yes, for
malaria.
Yeah, malaria. Anti-malarial drugs is given free of cost.
Anti-malarial drugs is also given free of cost. Free tests, free treatment. But instead of going for treatment, it is better to prevent by ourselves, by keeping our environment clean, use the treated mosquito nets, and stay healthy. And before we conclude, I would like to, ask Imse Bendla to give us a message to the audience, if you have any message about vector-borne disease that concerns you.
Okay.
Yes.
Actually, just a short message is that our health is in our hands. So in order to overcome like all those like vector-borne diseases, okay, government is there, allied departments are there, faith-based organizations, stakeholders, government, NGOs are there, but it depends upon you and me, because everything, it starts from our own home. So I request our community people, our own people, to keep our surroundings clean. That is the most important. And then now the transmission season is ongoing for all the vector-borne diseases. We have reported cases from dengue. As compared to last year, this year till September, dengue cases we have reported only 16.
I see.
Then Japanese encephalitis, 8 cases so far. Then malaria, it's only 2 cases. It's indigenous. As in total, malaria was reported 9, but like 7 was imported and 2 was from indigenous.
I see.
So as compared to last year, the cases are like reduced, but we never know, because the monsoon is the rainfall, that the means like the geographical condition of our places is like that. Rain comes, goes, and it's like sort of inconsistent also because of the global warming and all. So I think because of the environment factor, as well as please that we request department also, we also request to keep our surrounding clean. And then you always, we girls usually we are very fond of this flower pots. So usually in Dimapur it's raining off and on. So the water used to accumulate in the saucepan. So always keep that, like overturn and you keep it dry. Then in Dimapur, like we use AC also, fridge also, so that because of the little bit water accumulated, and within just hours the larvae used to produce, so it multiplies very fast. Then coconut shell also, like Dimapur we have coconut, so many coconut trees, so that coconut shells, and then during rubber plantation also we have rubber, so many rubber plantations, so we are in the habit of like accumulate the rubber, that rubber tree, then we don't clean that thing, so you have to keep it clean, and you have to dry it. So small things like where we public can do it. So I think the health is in our hands, so if we can do that, then I think the diseases, that vector-borne diseases can be fleed away from us.
I think most important thing here is don't let water get accumulated in any place, anywhere. So you prevent the mosquitoes to breed there. Dr. Tinurendla, Imse Bendla, thank you so much for coming to the studio and talking to us about vector-borne diseases. And we do look forward to you in future as well. Talk more about other diseases as well, or the progress that you have made with the vector-borne disease as well. Thank you so much.
Thank you.
Well, viewers, that brings us to the close of this small discussion on vector-borne disease control program. And let us stay safe, healthy and fit until we meet you again at Top Form another time. Bye.